Hey everyone, welcome back to the Outcomes Rocket. Thanks so much for tuning back in. It's been quite some time since I've had Dr. Robert Pearl on the podcast. In fact, I think it's been about 5 or 6 years. Today, he is with us and he needs no introduction, but hey, for those that don't know Dr. Pearl, let me just give you a quick intro. He was the CEO of the Permanente Medical Group, Kaiser Permanente, that is, from 99 to 2017. In that role, he led 12,000 physicians, 42,000 staff, and was responsible for the nationally recognized medical care of over 5 million Kaiser Permanente members on the West and East Coasts. He's here today to share the latest update, and that is his new book. It's called ChatGPT MD, How AI-Empowered Patients and Doctors Could Take Back Control of American Medicine. Debuted as number 1 on Amazon's new bestseller lists, and all profits of this book, get this, they go to Doctors Without Borders. Just an incredible person, a lot of recognitions, named one of modern healthcare's 50 most influential physician leaders. I keep up with his work on LinkedIn, his articles. So, Robert, so great to have you back on the podcast.
Hey, Saul, it's going to be great to be back with you. Next time, let's not wait 5 more years.
I love that. Let's make it more frequent. Couldn't agree more. Look, I'm so excited about your book. But let's talk about what inspired you to write this book.
As you know, I published Mistreated, Why We Think We're Getting Good Health Care Usually Wrong, 2015. I wrote about the system of medicine, the problems that happen when care is fragmented, doctors don't collaborate, coordinate, when you have payments on a piecemeal, a transactional fee-for-service basis. And I had hopes that medicine would quickly change. Lo and behold, a couple of years later, things aren't very different. So I asked myself, why? What's going on? I said, there has to be another factor, and I researched it and came up with the idea that maybe it was the culture of medicine, what we learn in medical school and keep with us across our entire careers. So I wrote on caring, how the culture of medicine kills doctors and patients. I thought I had found the secret sauce, what was going on underneath the surface, and lo and behold, a few years later, not much had changed. So I had to ask myself, I teach the Stanford Medical School, the Stanford Business School, and that's how I approach problems. When something doesn't make sense to me, I ask, what's going on underneath? And I said, what's going on may be the fact that people know what to do. We talk about it as value-based care, but they don't have the tool. And then all of a sudden, 2020, 18 months ago, up pops ChatGPT, generative AI. And now suddenly, we seem to have exactly the elixir. I've been writing about this for a while and encouraging Apple to build it into their devices, AI intelligence, build it into Siri or build it into Alexa. How can we as patients and clinicians have ready access to information and expertise? And then all of a sudden, it appears. And so that's what drove me both to write the book and to ask ChatGPT to be my co-author.
I love that. Okay, so you had ChatGPT co-author it with you. That's awesome. That is fantastic. Glad you did that.
I began, Saul, by putting in the 1.2 million words that I had published, so it knew my voice and knew my thinking. And after that, I went back and forth probably 200 times in every chapter, sending drafts, the way I would approach it with a medical student or with a resident, writing a paper and a book together. The driver of all of that was the reality of how fast generative AI is moving. It's doubling in power every year. It means that by 5 years from now, it's going to be 32 times more powerful. That's like your car 5 years from now being as fast as an airplane. Unimaginable to the human brain. That's exactly what's happening. And I realized if I took the same 2 years I normally would take in writing a book and editing it and sending it to my publisher and all the other processes that happen, by 2 years from now, anything I wrote would be out of date. It would be wrong. So I thought I had to speed it up. And that's why I thought and believed that ChatGPT would be a great co-author. But more than that, if I'm recommending this technology for medicine, I wanted to try it in a different venue.
Yes.
And not was in the writing and publishing of a book.
That's fantastic. Now, I really appreciate that, Dr. Pearl. And look, there's a lot of people out there And there's different applications, right? It took the world by storm, Gen AI, through the form of ChatGPT in particular. There's mixed feelings, right, around the technology. Around, hey, should I use it? Should I conceal the use of it? I say use it and be open about it, because it is the technology that's going to change the game. What do you think what about ChatGPT and Gen AI is going to change medicine for the better, in your view?
First, I think that generative AI, and again, I like ChatGPT because it's fitting well with my book title, ChatGPT,
Fair.
MD, all the letters flowing together. And as you say, it's just generative AI. It could be Gemini from Google, or it could be Claude, or one of the others, dozens of others that are likely to pop up onto the scene. The advantages in medicine are massive. There are some risks we need to talk about today, but I see generative AI being like the iPhone. It's going to permeate every part of the way that we live our lives. It's going to permeate every part of medicine. It's going to permeate the patient at home. It's why I talk about the AI-empowered patient. It's going to permeate the clinician in the office. It's going to permeate the hospital. It's going to be everywhere, because it's going to provide, and it does provide, not just knowledge, but also expertise. So if you look at the explosion of information across time, you can go back to the Gutenberg printing press. All of a sudden, rather than books being simply that of the royal elite, you had it available to the middle class. All of a sudden, you have universities, you have libraries. You go forward to the 20th century, the internet. Now suddenly on your computer, you can access information, click on links, find articles in ways that you never could before. Then you have the iPhone. You carry this in your pocket in the 21st century. The generative AI is going to be the next leap. But what's different about it is that it conveys expertise. And what I mean by that is you can paint a picture, not using ChatGPT per se, but DALL-E, but these are all derivatives of generative AI. It looks like a Rembrandt. You can program a computer, even though you never had an AI course. You can write a song that sounds like Drake, even though you don't play an instrument. You will now have expertise. And the expertise will be the doctor. And a lot of the technology that's happened over time has been to improve medical care provided by clinicians, but it's also going to be the patient. And I want to stress two things. First of all, the real power is the triad. It's the empowered patient, the dedicated clinician, and generative AI. And that combination is going to be far more powerful, far more reliable, far more accurate than any one piece alone. And second, I want to stress to listeners and viewers that I am not talking about the current version, GPT-4, or any of the other current versions that exist. But at the rate that it's increasing very soon, we're talking a 3 to 5 year time frame. That's what I'm speaking about. But having said that, don't wait. This is the time to experiment, to try it, to figure out what's possible. Last week, I was on a different podcast, and I was talking to the host after the show, and she said to me, my husband took a fall a couple of months ago skiing. His arm was over his head. He slid down the mountain about 100 feet, and his shoulder doesn't work well, and it's painful. What's going on? And she knew I was a skier and a doctor, so she figured maybe I could help advise her what was going on. And I do know, I had a pretty good sense of what was going on, but I said, let's wait. Why don't you put any information into ChatGPT? She wasn't even using the first version, no less GPT-4. Put all the information in place and see what you get. And a couple of days later, she emails back and she says, my gosh, this is amazing. It made the right diagnosis, a rotator cuff tear. It recommended the right treatment, the MRI, and it highlighted that surgery often is needed, and I should consult an orthopedic surgeon because delay could be problematic. And lo and behold, I did. That's exactly what the doctor said. Had I waited a couple more months, he might not have been able to fully reattach the muscle and the tendon that had detached from the bone. This is what we have today. Again, no one should use it without consulting a clinician, but it will provide expertise even in its current form.
Love that. No, this is fantastic. And I love the idea of the triad, the patient, the physician, Gen AI. And even I would expand it to say the caregiver, right? Like beyond that, right? Whether it be a nurse or an RT or whatever. We've had a lot of conversations, Dr. Pearl, on the podcast with leading companies in the JI space, from physician notes to payments. What are your thoughts around some of the technologies that are really existing today and what's coming in the future?
Well, first, let me say that I think we should stop talking about, in quotes, AI. We need to separate it into the different kinds of AI. There's rule-based AI, where clinicians put in place algorithms, the way we learn in medical school and residency. Computer programmers write it. It's very good at giving you a consistent answer. You know exactly where the information came from, but it can never be better than the people who created it. It's really only minimal AI. Then you have, around the year 2000, introduced neural networks, deep learning. Now you're looking at what I label and people call narrow AI. This is where you take 10,000 mammograms, 5,000 of which show cancer, 5,000 of which are normal or benign disease. And the algorithm and the tool itself finds 30, 40, 50, 70, 100 different slight differences between these two data sets, and is able then to assign a probability factor to each and be able to make a diagnosis about 10% better than clinicians. And there are 600 of those today. But they're called narrow AI because they only take on a small problem. You do mammograms, that's great, but you can't do chest x-rays or brain scans or anything else with it. Generative AI is completely different. Generative AI is taking all of the information on the internet, all of the textbooks, all of the journal articles, and putting it into place so that it can answer any question. And that is what the power is going to be of this. It's going to allow that patient at home to better manage their chronic disease. I mean, think about it. We have wearable devices now that are very accurate, very small little devices that can measure blood pressure, pulse, blood oxygen, blood glucose. Go down a list of physiological parameters that it's able to do. And what do we do with that data? Absolutely nothing. And why do we do absolutely nothing with it? Because the patient can't interpret it, and because the clinician doesn't want it all, clogging up their electronic health record or having to spend a massive amount of time. And what's the patient going to do? They have 100 readings of blood pressure. 80 of them are normal, 13 are abnormal, and 7 of them are uncertain. Do they need more care? The next visit is 3 months from now with the doctor. Should they call the office? What do they do? This is where expertise is needed. And the technology, based upon what the clinician puts in for the expectations, could answer that question. So going back to what you're asking about the AI that currently exists, most of it using generative AI accomplishes, I'll call more, in quotes, administrative tasks. But I mean, there are quite a number of tools right now that are quickly becoming AI scribes, able to listen in on conversations with patients and create the electronic health record that's needed, because right now clinicians spend way too much time staring at their screens, not looking at their patients. There's certainly a lot of tools that have been designed. Most of those are the narrow AI variety, not the generative AI, to battle insurance companies and be able to code differently and hire. Many of these are going to be very successful companies. They're not as interesting to me as this notion of how do we transform American healthcare? How do we move truly to a value-based healthcare system? How do we address the fact that there's 400,000 people who die every year from misdiagnoses, another 400,000 who are maimed and permanently disabled from an error in just diagnosis? What about the 250,000 people who die from a preventable medical error in a hospital? What about the 1 in 4 individuals who have a misdiagnosis while they're inpatient? What about the hundreds of thousands of people who have poorly managed chronic disease, diabetes, hypertension, asthma? We manage hypertension 60% of the time at best. It could be 90, 95%. We manage diabetes less than a third of the time. This is what is interesting to me and worries me, because it's not that clinicians aren't smart. It's not that they're not dedicated. This is not something negative about them. They just don't have the time to do these things. And that, I believe, is why we see 60% of physicians being burned out, an equivalent or maybe even higher number of nurses. How do we help them and augment it? This is not a tool that replaces doctors and nurses. This is one that fills in the gaps, that augments the care, that creates the time that we need if we apply it appropriately. And that's what has me so excited about this introduction of generative AI and why I wrote ChatGPT, MD.
Thank you. Thank you so much for that, Dr. Pearl. When people pick up your book, what should they expect to gain after reading it?
There are 5 parts to the book.
Okay.
The first 3 parts explains what is generative AI. How did this tool come about? How is it different than the other AIs? I briefly mentioned it here. And more importantly, what are the applications? How will it be used in hospitals? How will it be used in doctors' offices? Very importantly, how will it be used by patients at home? And what's likely to happen, not just in the first 5 years, but in the first 10 years? We said it'll be 32 times more powerful after 5 years. It's going to be 1,000 times more powerful after 10 years. We're going to take all the information that we use in clinical practice, coming off the electronic health record, coming off all the monitors that we have in the operating room, coming off of how human beings use robots in an operating room or pass catheters in cardiology laboratories. And it's going to learn how to predict what we would do next and duplicate it. It's going to have a massive amount of opportunity. And so that's the first 3 parts. And I want to get people excited by them. Part 4 is about all the problems. This is not a technology like any technology that doesn't have, I'll call, negative outcomes. There are privacy, security, bias, misinformation, the threat of job loss. And then part 5, in many ways, to me, the most important part is going to be leadership. Because this technology, no matter how powerful, isn't going to happen unless we can help people overcome their fears. And for clinicians, as you mentioned earlier, using this technology creates risk. It creates first a risk on one hand that a mistake's going to be made, that something will be done to harm a patient. There's nothing that, as clinicians, we fear more than inflicting harm on a patient. But there's another whole side that needs to be addressed, which is really going to be, how does this impact us both professionally and personally? And from a personal standpoint, if you think about this technology, what are we really trying to accomplish? If American healthcare today is unaffordable, with over half of people saying they can't pay their out-of-pocket costs today, what this technology can do is to keep people healthier. If we do the things I mentioned earlier around chronic disease, and there's a lot of data that said we'd be able to reduce the number of heart attacks, strokes, cancer, renal failure, peripheral amputations by 30%. What would that do to American medicine costs? It would drive it down dramatically. It would make healthcare far more affordable. But what would it do potentially to clinicians? It would erode their income. They're paid on a piecemeal fee-for-service basis. That's what we said. And if they have less work to do, they might make less money. That's pretty risky and threatening. You got a family, you got a house. The key is moving from the piecemeal fee-for-service basis to some form of prepayment, pay for value, capitation, call it what you want. Because now suddenly, it's just as valuable to prevent a heart attack as to reverse one. It's just as effective to avoid a colon cancer than having to do a major resection followed by chemotherapy. This is the opportunity that exists. And so leadership will be necessary, because as problematic as healthcare is today, the human nature is to persist and continue that which you know over that which is unknown. The comfortable, even if it's uncomfortable, the common, even if it's uncomfortable, over the future uncertain. And that's where leadership needs to make change happen. I often say what leaders do is they make things happen that otherwise would not. And when people have crossed that threshold, they never would go back the other direction. And that's what I believe will happen with generative AI if we can apply it effectively in medicine, for comfortable, empowering patients. And if we can work together, that's why I want to start now, figuring out how are we going to train patients around this? How are we going to help them to use it reliably and effectively? Because we don't want it, already doctors are too busy, clinicians are too busy. And if we don't use it effectively, then people just aren't going to do it. And the technology will be sounding great, but it will not have the impact that I believe that it needs to happen to improve quality, to make care convenient, to reduce burnout, and to lower costs.
Yeah, thank you so much for that, Robert. Thanks for breaking it down for us, from setting the foundations on AI to the different elements around it, the risks, and ultimately leadership. Folks, if this book's not on your shelf already, then order it now. We're going to put a link in the show notes so you could access it on Amazon. So make sure you check that out. I imagine, Robert, it's available to ship as well as a digital copy of it, right? I'm sure all of them are available.
There's a digital copy if people want it in that form that can go to your Kindle. You can have it shipped. If you're a Prime member, they'll ship it pretty quickly, hopefully overnight. And later this month, I'll be recording an audio version for anyone who would like to be able to listen to that as well. But right now, yes, it's available on Amazon. As you said, it's number one on its new books list. Stanford just published its new books list. It was number one there as well. And anyone who wants more information, go to my website, robertpearlmd.com. There's a lot more information on all these topics. And I encourage viewers and listeners that if you buy the book, the profits will go to a good charity, Doctors Without Borders. Let me know what you think. Let me know whether you're excited about this or whether you're fearful of this. If you're a clinician, let me know how you're going to use it. There's some recent data that says 40% of physicians plan to use it next year in their clinical practice. I think we're at the dawn of a new era. I call it Healthcare 4.0, and I welcome feedback. The broader the conversation, the more diverse the opinions, the faster we'll be able to transform American medicine, and I believe make it, once again, the best in the world.
Amazing, Dr. Pearl. Thank you so much for that. I, too, am very excited about the stage in history that we are right now in. And so for everybody listening, take Dr. Pearl up on that. He also records a podcast, if you haven't had a chance, Fixing Healthcare and Medicine, The Truth. He's got a newsletter called Monthly Musings on American Healthcare, contributes regularly to Forbes. We're going to leave all those links in the show notes, but the most important one is the book. So make sure you take action on that book. Dr. Pearl, thanks for being with us today.
Thank you so much, and I thank you on behalf of ChatGPT MD.